Hello po sa inyong lahat. Today, let's talk about a health concern that many people face, a large thyroid nodule. Your thyroid is a small butterfly-shaped gland located at the base of your neck. It produces hormones that control your metabolism, heart rate, and body temperature. Sometimes a lump or a nodule can grow on this gland. When a doctor says you have a 5.9 centimeter nodule, it is considered quite large. To give you an idea, this is more than 2 inches in size. A nodule this big is often noticeable and can sometimes be felt or seen as a bulge in the neck, which is commonly called a goiter. It is very important to pay close attention to a nodule of this size because it can potentially cause other problems. When we discover a thyroid nodule, the first question in our minds is always, is it dangerous? Is it cancer? It is important to know that most thyroid nodules, even large ones, are benign. This means they are not cancerous and do not spread to other parts of the body. They are simply an overgrowth of normal thyroid tissue. However, a small percentage of nodules can be malignant, which means they are cancerous. Malignant nodules have the potential to grow and invade nearby tissues or spread to other areas, which is why we need to take them very seriously. The size of the nodule, like 5.9 centimeters, increases the suspicion and makes a thorough checkup with a doctor absolutely necessary to determine its nature. The main difference between a benign and a malignant nodule lies in their cells and behavior. Benign nodules grow slowly and usually stay within the thyroid gland. While they can become large and cause symptoms due to their size, they do not pose a threat to your life. On the other hand, malignant nodules are made of cancer cells. These cells can be aggressive. They can break away from the original tumor and travel through the bloodstream or lymph system to form new tumors in other organs. This is why we cannot guess or assume. We need medical tests to know for sure what kind of nodule we are dealing with. Remember, the discovery of a large thyroid nodule is not a reason to panic. Instead, it is a signal to take action. Knowledge is your first line of defense. Understanding the basics of what a thyroid nodule is and the difference between benign and malignant types empowers you to ask the right questions and work closely with your doctor. The goal is to get a clear diagnosis so that you can receive the proper care. Your health is a priority, and being informed is the first step toward managing this condition effectively and living a healthy, full life. Do not be afraid, be prepared. A large thyroid nodule, especially one measuring 5.9 centimeters, often makes its presence known through various symptoms. Because of its size and location in the neck, it can press on surrounding structures. You might experience a feeling of tightness in your throat or have difficulty swallowing food, a condition known as dysphagia. Some people also find it hard to breathe, especially when lying down, as the nodule may press on the windpipe or trachea. A persistent cough or a hoarse voice can also be signs that the nodule is affecting your vocal cords. In some cases, the nodule can produce too much thyroid hormone, leading to hyperthyroidism, with symptoms like anxiety, rapid heartbeat, unexplained weight loss, and trouble sleeping. When you present these symptoms to a doctor, they will begin a careful and systematic process to understand your condition. The first step is always a physical examination. Your doctor will feel your neck to check the size, shape, and firmness of the nodule. They will also ask you about your medical history and any family history of thyroid problems. This initial consultation is very important as it helps the doctor decide which tests are needed next. Your honest and detailed answers will provide your doctor with the clues they need to form an initial assessment of your situation. Do not hide any symptoms, no matter how small you think they are. To get a better look at the nodule, your doctor will most likely recommend a thyroid ultrasound. This is a painless and safe procedure that uses sound waves to create images of your thyroid gland. The ultrasound can confirm the exact size of the nodule, whether it is solid or filled with fluid, and if it has any suspicious features, such as irregular borders or microcalcifications. These details are crucial in assessing the risk of malignancy. The ultrasound gives us a very clear picture of what is happening inside your neck, guiding us toward the next appropriate step in your diagnosis. It is one of our most reliable tools. If the ultrasound shows concerning features, or simply because the nodule is large, the definitive test is often a fine needle aspiration biopsy, or FNAB. During this procedure, a very thin needle is inserted into the nodule to collect a small sample of cells. This sample is then sent to a laboratory, where a pathologist examines it under a microscope to determine if the cells are benign or malignant. While the idea of a biopsy may sound scary, it is a quick, minimally invasive procedure that provides the most accurate diagnosis. This test gives us the clear answer we need to plan the best course of treatment for you. Once a diagnosis is confirmed, your doctor will discuss the available treatment options with you. The right path depends on the type of nodule, its size, your symptoms, and your overall health. If the biopsy shows that the 5.9 centimeter nodule is benign and it is not causing any significant symptoms, your doctor might recommend a watchful waiting or monitoring approach. This means you will have regular checkups and ultrasounds, perhaps every 6 to 12 months, to see if the nodule grows or if new symptoms develop. For some benign nodules, this careful observation is all that is needed for many years. If the benign nodule is large enough to cause problems with breathing or swallowing, or if it is causing hyperthyroidism, treatment becomes necessary. One of the most common treatments for a large goiter is surgery, specifically a thyroidectomy. This involves removing part or all of the thyroid gland. Surgery provides a definitive solution by removing the nodule completely. If the nodule is found to be malignant, surgery is almost always the primary recommendation. Other options for certain types of nodules include radioactive iodine therapy, which can shrink the gland and the nodule, or newer techniques like radiofrequency ablation, or RFA. Your doctor will explain the pros and cons of each option for your specific case. A very important reminder, please do not self-medicate. You might hear about medicines like levothyroxine and think it can solve the problem. Levothyroxine is a thyroid hormone replacement medication. It is sometimes used to try to suppress the growth of certain benign nodules, but its effectiveness can be limited, and it is not suitable for everyone. Taking this medication without a doctor's prescription and supervision can be very dangerous. It can disrupt your natural hormone balance, leading to serious side effects like heart palpitations, anxiety, and even bone loss. Always follow your doctor's advice. They will prescribe the right medicine at the right dose, if it is needed at all. Ignoring a large thyroid nodule can lead to serious complications. If left untreated, a large goiter can continue to grow and cause severe difficulty in breathing or swallowing, which can become a medical emergency. A malignant nodule that is not removed can spread to lymph nodes in the neck and other parts of the body, making it much more difficult to treat. The risks of inaction are far greater than the challenges of treatment. This is why early consultation and following your doctor's treatment plan are so critical. Your long-term health and safety depend on making wise, informed decisions with your healthcare team. Facing a health condition like a large thyroid nodule can be emotionally draining. It is normal to feel worried, anxious, or even scared about the unknown. However, your mindset plays a very important role in your journey to recovery. Try to adopt an attitude of acceptance and hope. Accepting the diagnosis is the first step toward managing it effectively. It allows you to move past the fear and focus on the practical steps you need to take. Hope, on the other hand, is the fuel that will keep you going. Believe in the medical process and trust that with the right care, you can overcome this challenge and maintain a good quality of life. You do not have to go through this alone. Support from your family and friends is a powerful medicine. Share your feelings with them and let them help you. Their encouragement can provide immense comfort and strength during difficult times. Beyond your personal circle, remember that your doctor and healthcare team are your biggest allies. They are the experts who have the knowledge and experience to guide you. Build a strong, trusting relationship with them. Ask questions, express your concerns, and be an active participant in your own care. This partnership is essential for a successful outcome. Taking care of your mental and emotional health is just as important as treating the physical condition. Stress and anxiety can negatively impact your overall well-being and even your body's ability to heal. Find healthy ways to cope with stress, such as light exercise, hobbies, prayer, or meditation. If you feel overwhelmed, do not hesitate to seek help from a counselor or a support group. Talking to others who have gone through a similar experience can be incredibly reassuring. Remember, a healthy mind and a healthy body go hand in hand. Nurture both. In conclusion, navigating the journey of a large thyroid nodule is all about having the right information and professional guidance. From understanding the diagnosis to choosing the best treatment, every step should be taken in close partnership with your doctor. Avoid misinformation from unreliable sources and never self-medicate. Your health is your most valuable treasure. By being proactive, staying positive, and trusting the experts, you are taking the best possible care of yourself. With the right approach, you can manage this condition effectively and continue to live a healthy, happy, and productive life. God bless Po.